Welcome to North Hempstead Funday Monday. Today is our annual senior health fair. We have representatives from the state, the county, as well as the federal government, and of course our wonderful departments here at North Hempstead. All of our area hospitals are here as well. We have over 20 screeners doing things such as blood pressure, hearing, and skin checks, and so much more. As well as line dancing, yoga, and tons of fun stuff, even mahjong. So next time, come down any Monday now through Labor Day and join us at Funday Monday here at North Hempstead Beach Park.
Tell us what you're here doing at Funday Monday today.
Hi, so pretty much we brought some literature to educate about, pharmacy services that we offer in the store. We have some pharmacists on the staff that are going to do health review medications and,
blood pressure screening. Talk about immunizations that we offer.
Great.
Well, I'm Assemblywoman Schimmel, and this is a initiative that we've been doing for a number of years. It's with the Colette Coyne Melanoma Prevention and Skincare Awareness. We've reframed it called Skintelligence. What is your Skintelligence? And what that means is, do you understand the basics of being out in the sun? It's a very strong sun. We want people to be covered when you're outside, as you're wearing a hat, wear sunblock. Have a skin review. In other words, if you can, go to a dermatologist and have a baseline done of your skin. What does your skin look like? And look at it over the years. This is a projector where you put your head in and you can assess what kind of skin damage you have from the sun. And oftentimes skin damage comes from early on. Most of my skin damage happened when I was a child. Back in the day, we used to put baby oil on. Remember the days of putting baby oil on? So you can get that nice tan. Well, we've since learned that that's not so good anymore. Now, the only oil I put on is sunblock. So this is an opportunity for people to learn about how to protect their skin, because we want you around for a very long time, and we know that, we want you to be intelligent about the sun, because the sun is our friend, but the sun also can do some harm to us. So
we're the Bristol Assisted Livings. We have 8 communities across the metropolitan area, 7 on Long Island, 1 in White Plains. We're building out in Sayville. And basically what we do is we help families with their loved ones who need help with the daily activities of life. So whether it's, not being able to get out to the store anymore, the shopping, the meal preparation. Sometimes there are folks who need help with dressing and bathing and escort service. We like to keep our residents very healthy, active, and engaged. So we have an amazing recreational program that keeps folks busy from 9 o'clock in the morning till 9 o'clock at night.
I'm from the Community Outreach Program at Winthrop Hospital, and I'm a registered nurse. So when we go into the community like this, we do blood pressure screenings, and we talk to patients about programs we have, prospective patients, and we have a full prevention program. We teach seniors about balance and exercise, strength, flexibility, and so we're hoping that a lot of people will take advantage and sign up for our classes. They're free, and they're at the Welcome Center.
Hi, good afternoon. We are Town of North Hempstead Department of Services for the Aging Project Independence, and we are so excited to be at the town's Funday Monday and Resource Fair. We know that there are over 73 exhibitors here, all arranged by the Department of Community Services. They've done a wonderful job, and we are so happy to be here to provide information about Project Independence, the town's Aging in Place initiative.
Pet therapy dogs, our only purpose in life is to cheer people up and help them to heal. And they work in nursing homes, they work in schools, they work in hospitals. They're a little different from a companion dog. They stay with the owner. And our dog is Storm, and we go regularly to the Sands Point Nursing Home, to the Young Adults YAI program, which is adults with disabilities, and also we go to senior centers and occasionally visit homebound people in their homes or in rehab centers.
Hi, I'm Congressman Steve Israel, and I represent a very big district that extends from the Whitestone Bridge in Queens all the way out to the Nissaquag River in Smithtown. But I have to say that the town of North Hempstead does an incredible job taking care of its seniors, whether it's providing housing, assisting them with services, working on veterans issues, protecting Medicare. We're doing events like this. I'm very proud of the town of North Hempstead, very proud of Supervisor Kamen and the members of his town board for embracing seniors and making sure that everybody understands that they are our #1 priority. I'm fighting for them in Washington, D.C. as our #1 priority, and I have a good partner in the town of North Hempstead. So thanks, North Hempstead, for everything that you do.
We represent Here USA. We're located in 475 Northern Boulevard. We provide hearing testing, servicing, and selling of hearing aids.
We're a podiatry office based out of Great Neck, and we're here today to give information to seniors about foot health care, telling people how when they're diabetic it's important to have a foot exam at least once a year, and giving people some interesting facts and information, and doing screenings and free foot exams for our seniors in the town of North Hempstead. So your circulation's actually good. I can feel a pulse. Okay. The next thing we look at is the skin, make sure there's no openings, no lesions. Everything looks good. Okay.
Hello, my name's Sloan. I'm one of the physical therapists at Nassau University Medical Center, and we've been handing out pamphlets on healthy exercises and how to prevent a pain-free back. And we're also doing blood pressure screening right there. I think there's a gentleman right at the corner getting ready for his blood pressure screen.
Okay, I'm going to look in your other ear now. Yes, and if you want to. Okay, both ears are clear. Okay. Good. And I'm Dr. Allison Hoffman with Advanced Hearing Center. We're performing free otoscopic exams today to rule out cerumen as the participating factor in hearing loss. Everybody's welcome who attends for a free hearing screening as well. Thank you. I'm here with OCLI, Ophthalmic Consultants of Long Island, and I am from the Manhasset office, and I work for Dr. Broderick. I'm his technician. Look straight ahead. Straight ahead. What we were doing was a glaucoma screening, and I was checking her intraocular pressure.
My name's Dr. Franco. I'm a cardiologist. I'm on staff at St. Francis and the North Shore LIJ system, and we're here today to prevent accidents. 1 out of 3 seniors are going to fall this year, 75 to 80% repeatedly, 20% hip fractures, head trauma. We're here to prevent falls. 85% of falls in seniors are in our ear. So what we do is if we see they're at risk for falling, with a questionnaire, we do a test. If they sway, we can actually do a EKG of the inner ear.
1, 2, 3. Oh, 3 seconds. You want to try again?
I wonder if it's better on the other foot.
Ready, set, go. 1, 2.
No.
Oh no, it's only 2 seconds. So, my name is Dazifa. I'm from Ready Care Physical Therapy. I work as an aide at our therapy office, and we see a lot of patients every day who have problems such as vestibular issues or after an injury. We really love working with patients. We try to help patients out, reduce their pain. We're located in Great Neck and Farmingdale. We have great services like courtesy transportation, where we can pick you up from your home, drop you off, because a lot of senior citizens don't have that luxury anymore when they can't drive.
Hi, my name is Joan Bush. I'm from the North Shore LIJ Health System. I'm a health educator in the Department of Community and Public Health, and we have the opportunity to work with the community here today at Funday Monday, servicing our seniors that are such a valuable part of our community. At our table, we're doing blood pressure screenings, but there are several tables represented from North Shore LIJ doing a variety of screenings to make sure the community stays healthy.
My name is Sarah Seamers. I'm a nurse practitioner and I work at North Shore University Hospital and I'm with patient education and cardiac services. So I'm here to kind of empower patients, people about knowledge and knowing your numbers and knowing ways to stay heart healthy or get heart healthy. So it's just a nice little way to make it fun. When you get your cholesterol drawn, first they measure your cholesterol, right? And that should be less than 200, correct?
I'm 190.
That's called your total cholesterol. Then it forks off. So you have your HDL cholesterol and your LDL.
Right.
LDL cholesterol is the bad cholesterol. That's what's responsible for putting, plaque and fatty substances on your arteries. It's low. You want it low because it's lousy. So
Right.
L, low and lousy. You want that less than 100, ideally. And then the HDL, which is another question, you want high and happy. HDL is for high and happy. And men, you want it greater than 40.
Family AIDS is a home health care agency, and we provide home care for sick people in their own homes that meet the criteria. Do you have anybody in your home?
Yes, I do. My husband.
Okay. I'd like to give you the information.
Okay.
Give us a call. We also provide free training if you know of anybody who would like to be a home health aide, and employment as well in Nassau and Suffolk County.
Wow, very good.
Yes.
Good
Let me give you my business card as well. My name is Barbara, and I look forward to hearing from you.
Thank you so much.
Thank you for stopping by.
Hi, I'm Kimberly Mosscroft.
Hi, how are you?
I'm an attorney who specializes in the area of elder care, elder law, estate planning, Medicaid planning, real estate as well. We are based out of Syosset, but we travel all over the place. I've traveled to Bronx, I travel out east. We go to our clients because a lot of our clients cannot come to us.